Hello, my name is Panda Boma. I'm going to be performing dressing change using sterile technique. For this video, I have my dummy with the wound on it, my clean gloves and my sterile kit and some hand hygiene. I walk in the patient's room, knock, knock, knock. Patient grants me access. I walk in the patient's room. I close the door behind me. Before getting in the patient's room, I performed hand hygiene. I will go ahead and perform hand hygiene again in front of the patient to make them comfortable. I will introduce myself. Hello, my name is Panda Boma. I'm going to be your nurse for the day, and today your provider has asked that we change your wound. Is that okay with you? Patient says yes. What is your name and date of birth? Patient tells me their name. I check with your wristband. It matches the patient. So I'll go ahead and explain the procedure. So this procedure is going to take about 5 minutes. I'm going to change your wound and make sure that you are comfortable, okay? Patient says yes. And make sure the patient is in the comfortable position. Go ahead and put on my clean gloves. And I'm going to be accessing the wound. I'll go ahead and take off the old dressing first. Slowly making sure that it is not ripping off no skin, so parallel to the wound. Slowly pressing down on that skin. Take off the old dressing, put it in the trash. I access the wound for no drainage, no odor, nothing that is not healthy for the wound. Okay, this time I'm going to take off my gloves, put it in the trash, perform hand hygiene. I'm going to open my sterile kit, forward that to the bottom. Okay, right now I have my sterile kit. I'll go ahead and take my sterile gloves. Okay, I'll open up my sterile gloves and don my sterile gloves. I have on no jewelry, no watch. My sleeves are up, so I'm ready to go. So open my sterile gloves, maintaining sterility and that 1-inch border. Okay, at this time I'm going to don my non-dominant hand, pinching on that cuff. Working my way through, making sure I'm maintaining that cuff. Slowly working my way through. Left hand is in. I'm going to use my 2 fingers. Work my way through slowly. Making sure my glove is on. Now that it's sterile, I can fix it. It's a little bit small. Okay. I have my sterile gloves on. I'm gonna put this to the side. Okay, I have my dressing kit. This is gonna be my sterile hand and my working hand. So I grab on that cleaning kit, just the cleaning kit by itself. Drop it in my sterile hand. I'm going to use the cleaning kit all the way. I clean in a circular motion. Clean that in a circular motion. Toss this in the trash. I'm going to grab my gloves, drop it in my sterile hand. I'm going to dry around. Grab another one. Drop it in my sterile hand and clean around. Now that my wound is clean, this is remediation. I was asked to stop right here before I dress the wound, but at this point I'm supposed to take the taginum and place the taginum on the wound, the fresh dressing on the wound, and make sure it is clean and wear perfect, and put that new dressing on. But I was asked to stop at this level for my video. So right now I'm going to go ahead and take off my sterile gloves, 2 fingers in, all the way out. Drop this in my hand. Same thing. All the way out. Ball that, put it in the trash. Perform hand hygiene. Make sure my patient is comfortable. Hand them the call light. I tell them to contact if they have any issues. Thank them for allowing me to perform the procedure on them, and then I will go out and document the procedure in the patient's chart. Thank you.